Hey everybody, it's Dr. Rick, and I'm going to take you into what I think you should be doing at least every quarter. So this is my office that I share with my wife, and those of you who don't know, my wife is a dentist, I'm a physician, and we both work in Hoffman Estates, that 990 Grand Canyon Parkway, and Suite 214 is right here, but this is where I have my office. And I share it. Our objective has always been to get patients healthy. And I think there's ways to do that both with medical and dental. In fact, for those of you who haven't had your regular annual checkup, it's important for you to get in. And I know that people have, or they pay for dental insurance, definitely pay for medical insurance, but a lot of people don't take advantage of that. And this is the office. This is my, hello Dr. Seguil. That's Dr. Seguil and a random patient. You don't want to bother that. So it's important to get in on a regular basis. Why? Because there have been studies, this has been documented for at least the last several decades. When you have dental damage, it starts as an inflammation trigger to turn on heart disease. So now let's get into deciding why you should be using these instruments of torture. Toothbrush, dental floss, and toothpick. I'm a physician and I happen to deal with heart attack, stroke, and cancer. I also deal with a whole bunch of other easier problems before they get to that point with integrative medicine and lifestyle change. But I will tell you that the majority of those things, heart attack, stroke, and cancer, in addition to suffering, pain, joint disease, autoimmune disease, Hashimoto's thyroiditis, IBS, all that has a basis on inflammation, quote unquote inflammation. That's a broad term that can be applied to many different things, but theoretically, if you can control inflammation, you can control those three big diseases and other symptoms of suffering. Again, everybody has to have a personalized plan, and if you don't have a personalized plan, go see your doctor. If your doctor doesn't want to give you one, then you can come see me, even if you're from another state. I'll put the link down below to my integrative medicine clinic. But the reason I wanted to talk about these instruments is that there have been, over the last decade, 2 decades, there have been enough data points and meta-analyses looking at the association between the three big diseases that I was talking about earlier and periodontal disease. So periodontal disease is when you have inflammation in the gums mostly, but secondary to the teeth. Now the gums, teeth, and the bone that the teeth are drilled into or anchored in are all one unit, just to make it easy. And when you don't take care of your teeth, meaning brushing your teeth every day, going to see your dentist for cleaning, getting plaque taken care of, flossing, when you don't do that on a regular basis, as a young person, you'll be told that you have bad breath and you're not going to get any dates. But more importantly than that, and before that happens, your parents will probably tell you, hey, what's up, dude? Or your siblings will not hold back anything and they'll say, get away from me, especially in the morning, doggy breath. Sometimes just by default, you'll brush your teeth or your gargle because you don't want to be the outcast in the group. If you pay attention to what you do with these instruments, you can actually control inflammation. Because unfortunately, a lot of my patients are worried about a heart attack. I hit 60 and I gotta tell you, every time my heart beats hard, I'm like, oh shoot, I wonder if I'm gonna be having a heart attack. It's only 17 to 18 years before I hit the average death rate in the United States, 78. You know, that has to be playing on a lot of people's minds, especially when you hit 70. You have 8 years to go. Unless you really take care of yourself, then you might have up until 100 years to go. I'd like to get to 100, but I don't know how that's going to look, and I don't want to be a piece of paper or a twig being dependent on my great-grandkids. So I'm trying to pay it forward by doing all these things, including taking care of my teeth so that I will have everything out of the way, no speed bumps, no hiccups, and just go and live. And it's going to be lonely, I think, because nobody else is interested in the same thing as me. But I'll be sitting on top of a mountain, probably in a monastery, and just meditating for the world. Anyway, back to more practical meditation. You should meditate on your teeth. The idea would be that you have to get rid of disease before it builds up. Because when it builds up, especially periodontal disease, it causes inflammation. And I'm going to start presenting to you why I think there is an association between periodontal disease and my patients having persistence and or a worsening of their disease process. So everybody that sees me usually does not want to be on the medicines that their cardiologist gave them. I'll just talk to my patients that have stents, that have had heart attacks, or that are on medicines like Plaques, aspirin, Xarelto. If those things sound familiar, then I know that your doctor is trying to deal with your cholesterol or your heart disease. And I'm going to make an argument that if you take care of that, cool, there's ways to lower your risk naturally. And if you don't know about that, then please subscribe or be a patient of mine and I can help you navigate that. Having periodontal disease also acts as a trigger for turning on inflammation. But I have to explain to you first what periodontal disease is and then what inflammation is. So let's start with inflammation first. If you just have a blood vessel, and a blood vessel lumen is just like this. So there's just single cells that make up endothelium. This is a blood vessel. Just so you have a reference, that's the lumen, and that goes that way, and blood goes that way, right? Typically, you'll have the lining of the blood vessel intact without any tears in it. Once you have a tear, and when you have a gap that's available and there's no cells, then unfortunately you have something exposed here. And when you have an exposure, you will expose the components of the blood flowing through this way to von Willebrand's factor. And you don't have to, I don't have to get into the technical details, but when there's an exposure, then these little things called platelets that float around in the bloodstream, innocuous. They float around waiting for a fight, kind of like mall security. They're just walking around. When there's a problem, then all the mall security comes to the same spot and they intimidate by force to hopefully put the bad guys at disadvantage. And then they'll call police in and they'll have more things come to the area to quiet down the problem, the occurrence. When von Willebrand factor is exposed, these guys get turned on and they magnetically attract to this thing, the von Willebrand factor. And typically, if you don't know about VW, you might know about nitrous oxide. So these cells, which are one cell thick, they are also covered by something called a glycocalyx. You don't hear about this, but I've studied it and reviewed it enough. Almost like the lining of the gut. Actually, it looks about the same. So if you have the small intestine here, and you have the villi columnar cells, one cell thick, that line the small intestine. Let's just take that for an example. On top of the columnar cell, you have this slimy layer. And the slime is supposed to be the house for the probiotics or your microbiota. So you have several different layers. And then, so the food goes this way, and it has your digestive system breaks things down. Sorry for the riff, but you'll see why. Your little bacteria here take some of the food and break it down further and allow some food to go through the slimy layer, through the one cell organism or the lining, into this area where the white blood cells are, and then into finally the blood vessels, which are over here. And then it's carried off to the liver. That's the cool part. So you always have to have a slime layer. It's not just cells. Same thing happens in the blood vessels. In fact, because force goes so strongly in one direction, if you didn't have a slime layer called the glycocalyx, and on top of that you have a positive and negative charge, but if you didn't have that, these cells would be irritated because of the flow, especially when you're under excitement or when you have high blood pressure. The flow of blood this way in the blood vessels, whether they're small, medium, or large, will be devastating. Yeah, think about a river, like the Grand Canyon and the Colorado. The river carves into stone over the course of centuries, but river and pressure win over stone. And that's why you have a river and riverbed. That's what the Grand Canyon is. Well, same thing with the lining of this capillary. When there's enough force going this way, if you don't have that slimy layer called the glycocalyx, then your cells would be destroyed and irritated. And that wouldn't work because you have these things called platelets waiting to look for more irritation. As soon as you have irritation, like the exposure here from a break, or a tear in the blood vessel, then these guys all go this way and they form a platelet plug. So platelet plugs are the beginning of a scab, and that's how the repair process takes place. And as I was alluding to, another thing that you'll find in this slime layer is nitrous oxide, NO. So those of you who are cyclists, when you take in beetroot, like a seaweed component that makes the glycocalyx thicker, like arteriosil, they're all there to increase NO. And they do that by making slime when you have been irritated or denuded of slime. And there's some argument that COVID has taken away the slime layer, and that's why everybody that's post-COVID has a whole bunch of clots and inflammation and just doesn't feel the same because you've destroyed the glycocalyx. I take arteriosil every day, twice a day. I suggest it to my patients who also have a lot of disease, zonula deficiencies, same thing with problems that happen in the colon. When you have a loss of the lining, I do believe that it equals a loss of the lining here, and it sets you up for inflammation. So, sorry for that riff, but I think if I explain it better, you'll see why you should have dental cleanings all the time. So when you have an area that's denuded or torn, the platelet plugs start, and then you'll have a clot that forms. Eventually, you'll have a clot that forms like this, and it starts to heal itself. Now, the problem is, as the clot is forming here, and it takes up space, your flow is decreased. And when your flow is decreased, especially in a moderate size or medium-sized blood vessel or artery, what happens with that? That's kind of like ischemia. Those of you who have had a heart attack, or those of you who had parents or relatives with heart attacks, you know they'll have grabbers, they'll have widowmakers, because there was suddenly a decrease in the lumen size. And because the blood couldn't flow anymore, everything after that little blockage died. Let me explain how that happens and why your teeth will actually turn this on. So I just explained what happens when you break this single cell layer, right? Now, what happens furthermore if you have high cholesterol? And I am an integrative medicine doctor, and I do think that I can lower your inflammation nicely depending on who you are and what we find on your vision board and your blood tests, cardio IQ, LP(a), insulin levels. If you do have a problem, this is what's going to happen. So I can't ignore the data that has been released about LDL and the association with some patients who have familial hypercholesterolemia. And even if you don't have FH, you can still have elevated cholesterol, not genetically, but because of the lifestyle you lead. And nowadays we're sedentary, we eat way too much, or we eat between meals and we don't exercise. And we're totally stressed out and underslept. So all those things add up to early death. And typically the early death is because of either a heart attack or a stroke. Cancer can come, but it's not as aggressive as the heart attack or stroke. So what happens in the data from even down in Dean Ornish's time and information from what the trials have showed is that when you have a lot of cholesterol in the bloodstream, cholesterol heading this way, that's orange here, and enough of it, cholesterol and triglycerides, that sometimes what'll happen is some of this cholesterol goes into and between these cells of the blood vessel and ends up over here. It ends up in the tissue. And when it ends up in the tissue, because it's so small, it penetrates through, especially LP(a), the smallest LDL particle, and the one that's probably most inflammatory with a little tail on it that explodes. Well, there are cells here called macrophages that go around and hunt. They go in here and they see, hey, you're not supposed to be here. Remember mall security? So what this macrophage does is it eats the cholesterol particle that's in the wall. When it eats a cholesterol particle in the wall, it becomes a foam cell. A foam cell, just like foam for a fire in a kitchen, it becomes a foam cell. And if you have enough foam cells come in and start to engulf and put the fire out, what'll happen is it changes the anatomy of your wall. Well, the anatomy of this wall starts to bulge into the lumen, because you have all these foam cells surrounding bad LDLs, LP(a)s, And eventually what happens is this lining is totally off. So the single cell becomes stretched out like this, and eventually it's stretched out so much because this thing presses out that you'll have a separation. The separation of the lining will expose to the same thing as before, von Willebrand's factor. And guess what happens? I'm kind of summarizing this, but I'm just doing it to show you why you should brush your teeth and floss and see your dentist. When you have an exposure to von Willebrand's factor, bingo, you'll have the platelets go here outside of your plaque formation. This is a cholesterol plaque here, and it starts to clump up platelet plugs. So on top of this big foam cell pimple inside the blood vessel, you'll have a platelet plug on top of that, and that definitely will cause even faster narrowing. What might be dangerous too, which is why some of you that have seen a cardiologist are on Plaques and aspirin, is that the platelet plug can actually break off a piece and send it this way. So if you have a platelet plug, if you have a whole bunch of foam cells and a plaque, this is a plaque, this is a platelet plug, PP, and then this is a small little fleck of atheroma, or the platelet plug that gets pushed that way. It causes an embolic phenomenon and blocks up something else. Obviously, this tiny little guy that comes off of here, it doesn't really do anything in this wide caliber, but has the blood vessels start to narrow downstream in the brain, in the kidney. Then it starts to get smaller and smaller, and this little guy will come in here and lodge and kill something. So you'll have limb ischemia, you'll have blindness, you'll have a brain infarct or a stroke, you have a little bit of a widowmaker, a mini widowmaker, you'll have a pulmonary embolism, you'll have disease that just pops up. So that is why I say you should be brushing your teeth, seeing your dentist on a regular basis. And let me explain why. If these are your teeth, this actually causes inflammation in the gum 24/7. This irritation here turns on, guess what? Platelets. Those are the upper teeth. These are the lower teeth. They're even worse as far as illustrative effect. These are gums. So these are the teeth, those are the gums, and that's your plaque that you never got cleaned out, because it's hard to brush plaque away. Well, actually, that's irritating the platelets, and it's causing the platelets downstream somewhere else to form a platelet plug or be hotter. If the mall security is quiet, then all the guys are walking around slow. If the mall security is on, they're alert, something's been triggered, then the mall security is looking for a fight, looking for help. And that's what happens when you have these little plaque formations because you did not use your dental device to clean properly, or you didn't use the dental pick to get between and floss between your teeth, or you just don't brush your teeth, or you smoke, or you eat sweets that are too much, because sweets will cause bacterial buildup and cause inflammation too. Then the platelets will be irritated because of the teeth and the gums, and the platelets will go further. They won't necessarily cause a heart attack in your mouth, but they will go elsewhere. And if you happen to have an elevated cholesterol, high blood pressure, or just inflammation from diabetes, and there's an area anywhere in your body where there's a plaque, the platelet plug will be forming around that plaque much earlier than if you didn't have gum disease. That's my explanation. If you do have disease, get your teeth cleaned on a regular basis, see your dentist, or go see my wife in Hoffman Estates. And if you mention that you're one of my patients, we should be able to work something out, especially if you don't have dental insurance, which some patients don't, or the high deductibles there. At least get in for a screening if you're one of my patients. And then, depending on what the dentist finds, my wife or your own dentist, then you can have intervention applied. Now, sometimes it might be, a root canal. It might be just taking care of cavities. It might be just drilling away at plaque and getting your teeth cleaned. But there's always something cool about going to the right dentist and having your teeth cleaned. There's a great feeling. And that's not just because you can eat more. The dentist has just taken away a lot of inflammation. And typically, people that have inflammation taken away will feel good for a couple of days because your body decreases inflammation elsewhere too. And it's not just the blood vessels here in the heart, it's also if you have autoimmune disease. Blood vessels will carry inflammation and triggers everywhere, including if you have antibodies that are floating around, the antibodies get hotter when you have a reason to get hotter. So Thus, the reason you should be doing your own self a favor by taking care of inflammation when you can. You go to see a dentist to take care of inflammation up here and preserve teeth. I mean, you can certainly have false teeth, which there's always a funny commercial on TV where somebody's laughing and the teeth fall out. Well, nowadays you have bridges and you have implants and crowns and veneers, which is really cool. But it all begins with healthy gum and teeth cleaning and surveillance. So start with that. Just because you take care of your teeth doesn't mean you can ignore no exercise, eating crappy food, eating between meals, having unbridled stress, not getting into nature, having poor sleep. You should still do all that other stuff, but this just complements it to be a well-rounded individual. Those of you for your disease are using aspirin and Plavix because you've had a stent or a little bit of a heart issue, I think it's fair game. Sometimes as you get farther and farther away from the embolization or the plaque and you've reversed it, you can take one or the other, Plavix or aspirin. Aspirin is a cyclooxygenase blocker and it decreases platelet plugging. Plavix, for those of you who don't know, Plavix is clopidogrel. It's a P2Y12 platelet inhibitor, or at least it works on an enzyme that turns down platelets, so it helps too. Some of you might actually be on more aggressive stuff, like if you have atrial fibrillation, or if you had a stroke, or if you've had a stent and you're not behaving yourself and you're still smoking, you'll be on DOACs or warfarin. DOACs used to be called NOACs. Things like Xarelto, I think I mentioned it before, or Pradaxa or Eliquis. Those are the next level. They're called anticoagulants. Specifically, anticoagulants block or they inhibit the coagulation cascade, which is a little bit different than a platelet plug, but still the same thing. You block up the artery because you're being triggered by something. Sometimes those of you who do see cardiologists or neurologists, you have to be on blood thinners. And I have one patient that was on aspirin and Plavix, and then she went to the hospital because she had chest pain. God bless her. And the doctors said, nope, it's not working, so your atrial fibrillation now has to be taken care of by Plavix and Xarelto. So the doctors have escalated her medications, and it might seem like she's taken 3 of the same things or 2 of the same things, both blood thinners, but there is science, and science does prove that it helps preserve life. The problem is if you're on a blood thinner, and you do have disease, you have to get your clearance from your cardiologist before you have the dental evaluation, or you get your clearance from me, your primary care doctor, before you have the dental. But most dentists that know their stuff can take care of prophylactically antibiotics if it's necessary, or just getting clearance. So those medicines that preserve life, like Plavix, aspirin, and Xarelto, sometimes they have to be messed around with if your disease is progressing. So this should be the issue with a lot of you with dental disease or ongoing disease and aging. You should really pay it forward and try to live the healthiest life you can. And you can change the direction of your disease process, honestly. Even if you're seeing every specialist in the world, don't be apprehensive, but from this point forward, whether you're on a whole bunch of medicines or you refuse to take medicines, you have elevated cholesterol, trust that there's always the proper use between medicines and herbs and lifestyle and brushing your teeth. I think something as easy as that will decrease one risk factor that'll calm down the platelet plug, and then we can reverse your cholesterol in due time. So hopefully this wasn't too confusing a journey, but I did want to explain why it's important to see your dentist on a regular basis. And my wife is in Hoffman Estates. We have a clinic in Hoffman Estates that we share, and why even if you are apprehensive about going to the dentist's office, at least get this going and or this going, and brush your teeth after every meal, and don't eat so much. So 2 meals to 3 meals a day, fine. Alcohol, tobacco, it's probably a no-no. Sweets, definitely a no-no. If you're going to eat sweets, I guess you should be brushing your teeth afterward. Even those of you who take CBN or CBD or THC at night in the form of gummies, do it first, digest that stuff, dissolve it, swallow it, then brush your teeth. Otherwise, you leave a film of sugar on your teeth, and that's where the bacteria will come in. I should mention that as the last thing. The other data points that have been associated is that in the plaques between the teeth and on the gum, there have been bacteria that have been found in atheromatous plaques of postmortem autopsies. So they found the same bacteria. So there is a link. The question is whether if you kill all the bacteria up here, will you reverse the possibility of heart attack? I think you'll postpone the heart attack. The association between bacteria, I'm not sure it says causation, but it says there's an association. The bottom line is that for sure, plaque formation can increase your chances for a heart attack. So get your dental checkups, come in to see your doctor or see me. If you're interested, I'll put the link down below. Subscribe to my channel. I put out videos all the time. If you cannot, then ask your doctor to guide you or your cardiologist to guide you, but good luck with that because they usually spend about 5 to 10 minutes and I don't think there's that much time to educate, so you're kind of on your own. But I'm glad that you're looking. Thanks for watching. Don't forget the comment section down below as far as questions, if you have any, or successes if you've had any, and I'll see you at the next video. Thanks for watching.